Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Shelley Hearn, the Dean Sommer and Clagg Professor and Director of the Lerner Center for Public Health Advocacy, returns to guest host the podcast, and she talks with Judy Monroe, the President and CEO of the CDC Foundation, about the intersection of climate, health, and advocacy. Dr. Monroe brings her insights and lessons from past roles as Indiana's State Health Commissioner, President of the Association of State and Territorial Health Officials, and CDC leadership positions on why public health must engage in advocacy and the climate crisis. Let's listen.
Hello, Judy Monroe. I am so happy to be talking to you about this intersection of climate, health, and advocacy. I kind of think, though, for our listeners, I need to explain why this is such an important conversation. And I'm gonna put you a little on the spot. I'm gonna make you a little embarrassed, but you really do have an amazing, unique experience taking on some of the country's most vexing problems. I'll give our listeners a little bit of a top line. You were the Indiana Health Commissioner. You've been president of the National Association that represents all the state health officials. You've held key CDC leadership positions, and now you're heading up the CDC Foundation. So I actually have a shorthand title for you if you want to hear it.
Absolutely.
Are you nervous?
I'm bracing myself.
You should. You know, we've known each other for a long time, but I envision I'm gonna have this made. I'm gonna put this plaque on your door, and it's gonna say "Problem Solver for Public Health."
I like that.
Yeah,
I'll
you're the problem
that.
solver. You're the fixer. I'm serious. I mean, think about it. You have been enmeshed in so many tough issues. It's not just today in COVID, opioid misuse, tobacco control. I mean, the list, it just goes on and on. So I got to ask you, why is climate on your and the foundation's radar?
Yeah. So, Shelley, climate is big. It's really big. And one of the things that concerns me is that folks don't see always the intersection of climate and health and advocacy that we're going to talk about today. You know, climate change has been with us for a long time. We've had a lot of warnings. Those warnings have not been heeded as they needed to be. And now we're at a real crisis, and it's impacting health every day. Everyone's impacted by climate change, whether they know it or not. But the health impacts are just overwhelming, and they're growing day by day. And so we've got to have public health at the table. Public health has got to be engaged. They need to be trained, and they need to be helping to educate the public. They've got to be good advocates. And there's just no two ways about it. This is an existential threat to our health and to our planet.
So you know full well that it is, as much as climate has some significant impacts on health, it's not really been a primary issue for the public health field. And I actually, it would be great to get your perspective, because I will never forget, it might have been 8 years ago, maybe more. You and I ran into each other at a global health conference. And you know how most businesses transacted in the hallways. I saw you. We started talking about the challenges of climate, which were not on the actual summit's agenda, but it sure was on your radar screen. And would you tell listeners that story? Because it felt like an epiphany to me.
Yeah, it really was. I was at CDC at the time as a deputy director of the agency, reporting to Tom Frieden, who was director at that time. And there was a meeting, and the meeting was in Iowa. I remember that. And it was a meeting that the Obama administration had convened. And there were a number of elected officials at the meeting, experts in climate and environment and so forth. And I sat there listening to not only the history, but the threats that we were all facing. And I was just incredibly alarmed. And at the same time, there was a convergence because I've got 3 kids. They're now, all in their early 30s. But at the time, they were becoming more aware of the challenges that climate was impacting our world and their future. And they were looking at what was happening. So it was kind of this convergence of the two that really did put me on fire. And I came back and I talked to folks at CDC. And now you've got to remember that CDC about 10 years ago started a program, and they've been working with communities. They've got the BRACE framework to help communities be more resilient. But I remember coming back and talking to senior leaders saying, we have got to step this up. We've got to be talking about it. We've got to make it more apparent to everyone that climate and health is really serious issues. And I remember the reaction was more, no, that's really for the environmentalists. That's really more, let's talk about decreasing the carbon footprint and those kinds of things. And that's not really public health. And so it didn't have the uptake that I thought it needed. And now here we are, whatever it is, 8 years later, and now the health impact of climate is worse than ever.
See, Judy, I told you you're ahead of your time, but I have you here because you're the problem solver. So you and I know this. Things have changed since then. Folks have either been listening to you or they're seeing the realities. They understand the facts. The science is you can't deny it anymore. But the challenge we have is state health departments that are on the front lines, and certainly many of the cities too. If I did a back of the envelope calculation, I would estimate that we have 0.0001% of the public health workforce funded to work on climate. There are a few exceptions. I know LA County, I'm hoping to have a podcast conversation with them in the future, but that is not the norm. So we know it's a health problem. We know that public health is gearing up and wants to be part of the solution. So how are we going to change this? Come on, problem solver.
Well, we really need to make the case, and we need to make some noise. I mean, we've got to be present and we've got to be everywhere talking about this. One solution is training, and we need to unlock the funding to train our health officers and our emerging leaders in public health around the climate issues and the intersection with health and what those policies need to be. We need to educate them on the solutions, and we need to grow the science at the same time, right? So there's a lot there. One area that I think we need to do is unleash the youth. That's an area that we're actually working on at the CDC Foundation right now because they are the future. They're also the future workforce, right? So when I say youth, I'm going well in from high school, maybe elementary, junior high, all the way up through the 20s. And probably 30s as well. But we need to engage them not only in the profession, but they need to be voices for us. And we know they've been tremendous asset as advocates around decreasing the carbon footprint and some of the passage of the most recent legislation. The youth have been great, but the youth are really impacted by mental health. And the mental health and the stress of climate, and some of a lot of them have lost hope. I have to tell you, I've talked to a lot of them, and they're anxious, they're depressed, and much of it has to do with climate. So they need to be part of our army and part of the coalition that we need to build around this.
Well, look at the success your own 3 kids had with you. Now, if we expand that logarithmically, I can imagine all kinds of epiphanies happening out there, and the energy that can derive from that. So absolutely with you. But you talked about training our officials, giving them capacity. We've got to get the resources to them. This is not a short-term, one-time, we train them and then off they run. We know very well the challenges that face health departments where there are many demands and often shrinking budgets. And we've got to think about how do we get sustainable dollars to really beef up the environmental health and justice capacity of our agencies. Is this something that you're hearing conversations about?
I'm hearing some conversations about it, absolutely. And CDC has, really stepped up, and their work with climate is expanded, but they haven't been able to unlock the resources. Neither has HHS. So we've got to do the advocacy on that part to get the governmental funding. I just co-chaired a commission in Indiana where one of the things that our recommendation to the governor is to put more funding into public health to be able to have capacity for data and the workforce that has the data capacity, the workforce that has the capacity to understand these problems. And so we need that actually at every level, the advocacy, whether it's at that local, state, or federal level. And then I'm at a foundation. So we're working hard right now to get in front of philanthropy. Philanthropy in the private sector can contribute a lot. But I will tell you, it's been a bit of a hard sell. And I think that's why this is so much work ahead of us, because it's critically important, but it hasn't been socialized enough yet. And so that's one of the big jobs we have to do.
It's an excellent point. It makes me think back in the early days of the tobacco battles. Public health did not have strong advocacy capacity, but It was private philanthropy, leaders like the Robert Wood Johnson Foundation and others that made some significant investments, not just in the issue, but building and training the workforce to understand how to engage in policymaking and politics. So there's an absolute parallel here, but let me bridge back. You and I, again, have been on a lot of panels. And in fact, I think we were on one a few months ago with the Academy of Health. And the first question that we got was, how do you keep politics out of public health? And I don't get flustered very often, but I remember just having oh my God, we're still in this challenge. So what do you have to say to our public health workers, and particularly if they're in government positions where they think that advocacy word is a dirty word, when in fact it's the very skills that we need for going forward?
It's very much the skills that we need. So I'm going to go back when I was first appointed state health officer in Indiana. I remember the lieutenant governor taking me aside and saying to me that I had been appointed state health officer because of my professional credentials, and that I needed to be very careful to stay out of the political fray, to not get into the fray. So I heeded those words, but then, of course, it didn't take me long to realize, but public health is squarely reliant on the political process for resources, for their legitimacy. I mean, there's so much that rides on the political process and the political climate. And so I found myself learning how to thread that needle. And as a family physician, I will tell you those skills really helped me a lot, because I came in, it was natural for me to want to understand what people cared about and how they were thinking about things. So I, in short order, got to be known as being respected on both sides of the aisle, recognizing that I was actually building my advocacy in building my relationships with both sides of the aisle so that I didn't end up getting politically charged. I tried to stay out of the hottest spots of politics, understanding though that I was in politics and I needed to every day be an advocate one way or another. I think these are skills that we've got to teach, but folks should not be afraid of being advocates at all. In fact, everybody can be an advocate in one way or another. So I think those are skills that are really important. It's an art. I think there's a balance there in public health and politics.
I appreciate you capturing that, because I think it is absolutely critical that we understand the policymaking process, and politics are part of that, but we must absolutely stay out of partisanship.
Right.
And you know just as well as I do that our success is if we have champions on both sides of the aisle. We can't be one issue or another. If anything, public health has been Cinderella and no one's been paying attention. We need champions on both sides, or all three. Get the independents in there too.
Exactly. So
that's a great lesson that I appreciate you highlighting. And if you were going to whisper to the next generation of public health leaders, many of them are listening now, What would be the advice that you would give our next set of leaders in being those champions, those advocates for public health?
Well, the first thing I would say to them is that we are in an inflection point in public health and we need them. And so that's the first thing, is a call to action. Don't shy away from being an advocate, and make sure that you do understand we are all human beings. So we all care about families, we care about children, we care about our communities. And so go there, go to the heart of what we as human beings care about on both sides of the aisle, and then make sure that you get to know folks across the entire spectrum, and the independents, as you say, as well.
Judy, you were talking about before of working with the youth as an important place to build hope. And I want to thank you. I'm not going to whisper. I'm going to give a big cheer for your work, your efforts, and your leadership in building hope with everyone. And I think that your lessons, your advice, and most important, we don't yell at each other. We find those common values, the things that unite us, that is going to build our advocacy ability to have a healthier, safer, more equitable world. So those are great words of advice. And Judy, I can't thank you enough for your time.
Great being with you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.